Hi everyone, it's Amy, and for this month's education we're going to focus on common treatments. The first one I wanted to start with are the pulse oximetry. This is more of an intervention than a treatment, but I wanted to go over this first because most of our patients do have some type of order for pulse oximetry. The most common one that we see is the device on the right lower hand section of my slide. The pulse ox can test your patient's oxygen saturation painlessly. There's no need to go out for blood work. It consists of a clip or a small probe that you place on a finger, earlobe, or toe. And it's really important that the sites get alternated every shift, especially with any patient that has continuous pulse oximetry. We don't want to have any breakdown of their skin. You need to check the orders for frequency because, like I said, it might be continuous, or you might have a patient that's only checked intermittently. Normal readings are 95 to 100%. Signs of decline are 94 to 100%. Below normal is 90%. And what I need everybody to do is to make sure that you're reading your plan of care and you know the parameters for your specific patient. Because what's normal for one patient and what their diagnoses are may not be the same for another patient. The values I gave you on this slide are pretty much like the average and what we're looking for in patients. The next intervention is suctioning. Every patient should have at least a bulb syringe in case they need it to be suctioned. We don't want anybody to aspirate. On my picture, you can see in the middle is a suction machine, which most of our patients do have. You would need to use a device like on the right side of the slide of the Yankar or the open suction. There's a little nose sucker on the bottom, which is really good for the smaller babies or toddlers. So the equipment you would usually need are the suction machine, the catheters, a multi-purpose suction device, which is the bulb syringe, a Yankar, gloves, sterile water, saline, and gauze. To suction using the suction machine, you must review your order, wash your hands, gather your supplies, prepare your patient. Head of the bed should be elevated or they should be in a sitting position, and you should always explain anything that you're doing with your patient before proceeding with the procedure. You must don gloves, turn on the suction machine, connect the suction device appropriate for the type of suction you will perform, which is also in their care plan. So you would suction the patient nasally, orally, or deep suction per order. Apply suction when removing catheter and no longer than 10 to 15 seconds total. A lot of times I tell the nurses when I'm doing orientation is to hold your breath so that you can feel what the patient feels. So making sure that we don't go over that 10 to 15 second total. If it's necessary and you have to repeat the procedure, please allow your patient to take a few breaths before you go back down and suction them. It's very traumatic for somebody, so we always want to be conscious of that. You need to rinse the suction device with sterile water or discard when you're done. Wash your hands and document and continue to monitor the patient. Make sure you're documenting every time you suction, and then of course you're going to just document on what you see. What is the consistency, color, and is there any odor? Because we always want to be watching our patients for an infection. The next interventions or treatments I wanted to go over are our nebulizer and our MDI treatments. I like this picture because it shows you the nasal cavity, it shows you where the epiglottis is compared to the larynx and the trachea, and of course a nice picture of this little one's lungs. For a nebulizer or MDI, both systems allow respiratory treatments to be delivered to your patient to treat acute or chronic respiratory conditions. The MDI actually gets the medicine in quicker, but some patients don't tolerate it as well, and you can't get all the medications in this form. The nebulizer uses a liquid form of the medication, and it turns it into a mist that your patient can inhale directly into the lungs via a face mask or mouthpiece. Or if they do have a tracheostomy or vent, it can go either through the vent tubing or it can go right attached to the trach. It consists of a nebulizer compressor, tubing, a medicine cup, a mask or a mouthpiece, depending on how you're given it, And the MDI is a metered dose inhaler. This device is a handheld pressurized canister that delivers the medication. It can be used with or without a spacer to deliver the medication directly into the lungs. Many studies have been done and find that using a spacer is the most effective way to deliver the MDI. The patient receives more of the medication and has a better outcome. So in order to give an MDI, you need a spacer with a mask or a spacer with a mouthpiece, depending on how old or developmentally delayed your patient is. This slide just gives you a few examples. You can see the nebulizer machine, you can see the different mouthpieces. For pediatrics, they can actually come in fun, creative little animal apparatus. And then of course you can also see in the bottom right hand corner is the spacer and how that works with the mask. Very effective that way. Some of our patients have something that we call a cough assist. This assists patients with clearing mucus from their lungs. It's used in patients with a weak cough or ineffective cough. As the patient breathes in, the machine pushes air into the lungs slowly, and after a pause, pulls the air out. So it's the same mechanism as if you had a really good cough. Once completed, the patient can be suctioned to clear the mucus. And this is really important. You need to make sure that they can clear the mucus. You don't want them to suck it back in and aspirate it. And here's a picture of a cough assist for you. You can see it has the tubing that goes to the machine and a little mask that goes with it. You have to check your orders because they have specific settings that it has to be for your patient, and you need to make sure that it's set correctly every time. Chest PT is something that's very commonly used in our patient's home. It consists of a chest percussion, postural drainage, and or vibration. So there's a few ways of doing chest PT. In this picture right here, the person is using a little cup to kind of cup the little baby's lungs, and like you just hold this cup over each lung field and you just kind of pat them gently, and it helps loosen the mucus up, and hopefully your patient can get it up, or they may need a little bit of suctioning after. Some of our patients have what we call vest therapy, and this is a form of chest PT where a device that provides gentle vibrations to assist clearing mucus from the patient's lungs. The patient wears a device just like they would a vest, and this is very helpful for our patients. And again, you have to watch them and make sure that you are helping with any of their secretions that are coming up, because some of them can't cough that out. The other thing is there'll be very specific settings. A lot of the patients will have respiratory treatments before this is performed so that it loosens up the mucus before they even get to the chest PT. So for that, you'll have to check your orders as well. It should have a very specific order in which the medications are given, and then the chest PT is done. BiPAP and CPAP are also very common in our patient's home. BiPAP and CPAP are usually a treatment for sleep apnea, but also other pulmonary conditions, so it just depends on your patient's diagnosis. BiPAP can be used with a mask, or it can be used with nasal prongs, or in our trach patients, it can be hooked up to the trach as well. So BiPAP delivers a bi-level 2-pressure mode, an inhalation pressure and an exhalation pressure. CPAP delivers a continuous positive airway pressure, and that's the difference between the two. So in order to deliver this type of treatment to your patients, you'll need to have all your supplies: the BiPAP or the CPAP machine, tubing, mask or nasal cannula mask, humidifier, and most likely some filters. I just want to go back to that slide again. The other thing I wanted to say about BiPAP and CPAP is that you have to also make sure that the settings are correct for your patient, and that the mask is cleaned very, very well. Every time you take it off, it needs to be sterilized. Check your orders for how you're supposed to clean the mask. If it's not cleaned, your patient can get some upper respiratory infections or fungal infections in their mouth or nose. So it's super important that we make sure that we're doing everything we can to keep our patients safe. The last thing I wanted to talk about is the IPPB. It stands for intermittent positive pressure breathing. So this is used in patients who are unable to breathe deeply. It's a non-invasive ventilation, so they don't have to be trached to have this. It can also deliver aerosol medications. It helps to expand the patient's lungs, and you need to make sure that you check your MD orders for the individualized plan, when to use it, and what the settings are. I hope this helps everybody with some of the common treatments and interventions that we provide our patients in the house. If you have any questions or you want to come in and practice some of your skills in our skills lab, we'd be happy to have you. Have a great week.